Hi there! Welcome to Parents' Domain! If you are trying for a baby, TTC, you have likely been inundated with advice from every corner of your life. Friends, family, and 1,000 online forums will tell you everything from charting your basal body temperature and using ovulation prediction kits to switching to an organic diet, cutting out caffeine, and, of course, the age-old tip of lying with your legs raised against the wall after sex. It's a journey filled with hope, anxiety, and a willingness to try almost anything. If you're looking for a safe, welcoming space full of helpful resources and inspiration for parents, we'd love to invite you to visit parentsdomain.com. But here's a tip that may surprise you, one that is quietly gaining traction in TTC communities. Use a menstrual cup to increase your chances of becoming pregnant. The very same flexible silicone cup that many women use for a more eco-friendly and convenient way of collecting their period blood has now been touted as an alternative fertility hack. The idea, once whispered about in niche online forums, has blossomed into a mainstream topic of conversation among those hoping to conceive. Does this really work? Is there any scientific merit to this seemingly bizarre method, or is it merely another old wives' tale for the modern age? Does it work? Is it worth trying if you are trying to get pregnant? We'll explore this strange but increasingly popular method, delving into the theory, the science, or lack thereof, the anecdotal success stories, and the important safety considerations. What is a menstrual cup? More than just for periods? Let's begin with the basics, as understanding the tool is crucial to understanding the theory. A menstrual cup is a reusable, flexible, bell-shaped cup that's typically made of medical-grade silicone, although some are made from thermoplastic elastomer, TPE, or latex. Unlike tampons or pads, which absorb menstrual fluid, the cup is inserted into the vagina to collect blood. It forms a gentle seal against the vaginal walls, just below the cervix, preventing leaks. Menstrual cups are popular with women for a host of reasons that make them an attractive alternative to traditional period products. They are eco-friendly, as a single cup can last for up to 10 years, drastically reducing the waste produced by disposable tampons and pads. They are also highly cost-effective. The initial investment of $20-40 pays for itself within a few months. Furthermore, they can often be worn for longer periods than a tampon, up to 12 hours in some cases, offering greater convenience and freedom. But for the purposes of our discussion, the most important feature is its function: to hold fluid inside the body, directly at the base of the cervix. It is this core function that has been repurposed for use in conception, a context that is vastly different from its intended use for period management. The menstrual cup conception hack explained. The method itself is straightforward and generally follows one of two approaches. The post-intercourse method. Immediately after intercourse, while the woman is still lying down, she or her partner inserts a clean, sterilized menstrual cup into her vagina. The goal is to position the cup so it sits below the cervix, effectively trapping the semen that has been deposited there. The at-home insemination method. Some couples take this a step further. The male partner ejaculates directly into the sterilized menstrual cup. The woman then promptly inserts the cup, placing the collected semen as close to the cervix as possible. This method is sometimes preferred by those who find the post-intercourse rush to be disruptive, or by couples using donor sperm. Why would anyone do this? The logic is surprisingly simple. Hold the sperm closer to the cervix for a longer period. The primary goal is to combat gravity and prevent the natural, and often immediate, leakage of seminal fluid that occurs after intercourse. By physically trapping the sperm-rich fluid right at the doorstep of the cervix, the hope is to give the sperm more time and a better opportunity to begin their arduous journey towards the egg. According to Parents Magazine, Dr. Sherry Ross, an OB, GYN, and women's health expert, validates the underlying logic. A menstrual cup full of sperm will allow the sperm to only move in one direction, and that is toward the egg, she notes. It essentially creates a protected reservoir of sperm at the most critical location. Why it might work? The theoretical framework. The concept, while unconventional, is based on a few fundamental principles of fertility and reproductive biology. To appreciate why this hack has gained such a following, one must first understand the incredible obstacle course that sperm must navigate to reach the egg. For fertilization to occur, the sperm must travel from the vagina through the cervix into the uterus and up one of the fallopian tubes to meet a waiting egg. This journey is perilous, and the odds are stacked against them from the very beginning. Combating sperm loss. The most immediate challenge is leakage. It's completely normal for a significant portion of semen to flow out of the vagina after ejaculation. While this is not a sign of a problem, it does mean a large number of sperm are lost before they even have a chance to enter the cervix. Some research has shown that less than 1% of the total sperm ejaculated actually make it into the uterus. The menstrual cup acts as a physical barrier, aiming to dramatically reduce this initial loss and keep a higher concentration of sperm at the cervix. Navigating the vaginal environment. The vagina is a naturally acidic environment, with a pH typically between 3.8 and 4.5. This acidity is a protective measure against harmful bacteria and infections. However, it is also hostile to sperm. Semen is alkaline, with a pH of about 7.2 to 8, to temporarily neutralize this acidity and give the sperm a fighting chance. By holding the alkaline semen in a contained space via the cup, it may provide a more buffered, less hostile environment for a longer duration. The cervical gateway. The cervix produces mucus that changes throughout the menstrual cycle. Around ovulation, this mucus becomes thin, watery, and stretchy, resembling raw egg whites. This fertile cervical mucus is designed to help sperm swim through the cervix and into the uterus. A menstrual cup keeps the sperm pooled at the cervical opening, ready to take advantage of this fertile mucus when the timing is right. Temperature and environment. Sperms are sensitive to their surroundings. They thrive in a warm, moist, and protected space. Charlotte Doyle, a writer for We Have Kids, explains how sperm can survive for up to 5 days within the female reproductive tract, but only under ideal conditions. She writes, "The menstrual cup provides an environment that is mostly free of open air and also moist and warm. Without the cup," she suggests, many of these potential babies could die within the first 12 hours. While the timeline might be debated, the core idea holds. The cup provides a stable, body temperature incubator right where it counts. This method is especially appealing for couples who are concerned about timing. For example, if a woman confirms she is ovulating but her partner has a lower sperm count or motility, giving the sperm some extra help by keeping them concentrated at the cervix for a few hours could, in theory, make a significant difference. What if it actually works? Anecdotal evidence versus scientific proof. It is critically important to state this up front. There has been no formal, peer-reviewed medical study that confirms using a menstrual cup helps in getting pregnant. The scientific community has not put this method to the test in a randomized controlled trial, which is the gold standard for medical evidence. What we have instead is a mountain of anecdotal proof, countless stories shared on parenting forums like Mumsnet, in Reddit threads under r/trying for a baby, and within private TTC Facebook groups where women attribute their pregnancies to this very method. These stories often follow a similar compelling pattern. "We were trying for 8 months with no luck. I read about the cup method, thought it was weird, but decided to try it. I got my positive pregnancy test that very first month. My doctor told me it wouldn't hurt to try. I did it, and I'm now 14 weeks pregnant. I was skeptical at first, but the logic made sense. We conceived on the 2nd month of trying it." Are these just coincidences? Possibly. When you are deep into the TTC journey, it is easy to want to try anything that appears logical and carries a low risk. A couple trying for 6 months has a certain statistical probability of conceiving in the 7th month, regardless of any new method they try. This is the classic dilemma of correlation versus causation. Did the cup cause the pregnancy, or did it just happen to be the month that everything else aligned perfectly? Despite the lack of hard data, some doctors are not entirely dismissive of the idea. While many physicians are careful to clarify that it is not a proven method, they often agree that it can't hurt to try, as long as it is done safely and hygienically. The underlying principles align with other fertility-assisting concepts like cervical caps, which have been used historically for conception, or even the very basic principles behind intrauterine insemination, IUI, which involves placing washed sperm directly into the uterus, bypassing the vagina and cervix entirely. The menstrual cup can be seen as a very low-tech DIY version of getting sperm closer to the goal. What science says and what it doesn't. As we have already mentioned, research shows that the vast majority of sperm is lost immediately after ejaculation. Some studies suggest that within minutes, a significant portion has already exited the vagina due to backflow. Less than 1% makes it all the way up to the cervix and into the uterus. Theoretically, if the menstrual cup can hold the seminal fluid against the cervix for a longer period and reduce this immediate loss, then there could be some benefits. However, conception is not as simple as just keeping sperm in one place. The other side of the equation involves complex biological processes. Vaginal pH. As mentioned, the vaginal environment can be harmful to sperm. While the cup may shield the semen, it doesn't change the underlying pH of the vagina itself or the quality of the woman's cervical fluids. Cervical mucus quality. Cervical mucus is the true gatekeeper. It is what helps guide and nourish the sperm through the cervix and into the uterus, especially around ovulation. If the cervical mucus is not of the fertile egg white consistency, even holding sperm at the cervix for hours may not be effective. Sperm capacitation. Sperm do not arrive ready to fertilize. They must undergo a process called capacitation within the female reproductive tract, which involves a series of biochemical changes that allow them to penetrate the egg. This process naturally occurs as they travel. It is unknown if holding them in a static pool of semen within a cup could potentially help or hinder this process, though it's likely neutral as it still occurs within the body. Timing. Timing is everything. Even if the sperm are held in place perfectly, if ovulation has already passed or is still days away, conception cannot occur. Therefore, while the cup might solve the mechanical problem of sperm loss due to gravity, it doesn't address the myriad of other biological factors at play. Simply holding sperm in position may not be sufficient. The quality of the cervical mucus and the overall fertility environment are equally, if not more important. The pros and cons of using a menstrual cup for conception. Before you decide to try this method, it's wise to weigh the potential benefits against the risks and drawbacks. Here are some benefits of using this method. It's non-invasive. This is something you can do in the privacy of your own home without any medical intervention, prescriptions, or procedures. Compared to fertility treatments, it is incredibly gentle. Low cost. Do you already own a menstrual cup? If so, there is no additional cost. Even if you need to buy one, a one-time investment of $20-40 is significantly cheaper than months of expensive ovulation tests, fertility monitors, or professional treatments that can cost thousands. Can help retain sperm. Logically, the method should increase the number of sperm that remain at the cervix, potentially increasing the odds that one will successfully reach the egg. No medication is involved. This hack is completely natural. No prescriptions, hormones, or synthetic drugs are required, which is a major plus for those seeking a less medicalized approach to conception. Sense of agency. For many couples, the TTC process can feel frustratingly passive. This method offers a sense of control and a proactive step they can take, which can be emotionally beneficial. Cons and things to watch out for. Scientific evidence is lacking. This is the biggest caveat. There is no clinical data to prove this method improves conception rates. You may be pinning your hopes on a method that is no more effective than chance. Hygiene is crucial. This cannot be overstated. If you are inserting a cup after ejaculation, it must be impeccably clean and sterilized. A cup that has not been properly cleaned can introduce harmful bacteria into the vagina, potentially leading to infections like bacterial vaginosis, BV, or a yeast infection, which would be counterproductive to your fertility efforts. Timing and technique can be awkward. It can be tricky and a bit messy to get the cup into place quickly and correctly following intercourse. Many women find the process awkward or unhygienic the first couple of times, which can add stress to what should be an intimate moment. It may mask underlying fertility issues. This is perhaps the most significant risk. If a couple relies on this hack for many months without success, they may be delaying a consultation with a doctor. This method won't work if there are underlying fertility problems such as low sperm count, poor motility, blocked fallopian tubes, PCOS, or endometriosis. Delaying a diagnosis can delay effective treatment. Potential for discomfort. Not everyone finds menstrual cups comfortable. If you have a sensitive cervix or have never used one before, you might find it difficult or uncomfortable to insert and wear. How to try it safely and effectively. If you're curious and want to try this method, it's essential to do so safely. Here is a basic step-by-step guide. Select a soft, comfortable cup. If you're new to cups, a softer silicone model is often recommended as it can be easier to insert and more comfortable to wear. Ensure it is made from medical-grade material. Thoroughly clean and sterilize. This is non-negotiable. Before each use in your fertile window, sterilize your cup by boiling it in a pot of water for 5-10 minutes. Wash your hands thoroughly with soap and water before handling it. Track your cycle. This method is only useful during your fertile window. Use ovulation prediction kits, OPKs, track your cervical mucus, or chart your basal body temperature to pinpoint when you are most fertile, typically the few days leading up to and including ovulation day. Have intercourse as usual. Have the clean cup ready at your bedside. Some couples prefer having intercourse before inserting the cup to keep the moment as natural as possible. Insert the cup promptly. Immediately after ejaculation, while still lying down to minimize leakage, fold the menstrual cup. A C-fold or punch-down fold works well, and insert it into your vagina, aiming it back towards your tailbone. It should pop open and form a gentle seal. If using the direct ejaculation method, insert the filled cup immediately. Leave the cup in. Most women leave it in for a few hours. While some leave it in overnight, it's best to stick to the manufacturer's maximum recommended wear time, which is typically up to 12 hours. Start with a shorter duration, perhaps 4-6 hours, to ensure you are comfortable. Remove carefully. To remove the cup, wash your hands, get into a comfortable position, like squatting, bear down gently with your pelvic muscles, and then pinch the base of the cup to break the seal before pulling it out. Clean and store. After removal, empty the contents, wash the cup thoroughly with a mild, oil-free soap and water, and store it in its breathable pouch until the next use. Last thoughts. Is it a miracle hack or just a myth? Can using a menstrual cup increase your chances of getting pregnant? The short answer is, maybe, but don't expect it to be a magical fix. The theory behind the menstrual cup hack is sound, and its logic is compelling. By creating a physical barrier to prevent sperm loss, it could theoretically give more sperm a better chance to reach the egg. However, without scientific proof to support this theory, its effectiveness remains in the realm of anecdote and speculation. Many women swear it worked for them, but it's impossible to know if the cup was the deciding factor. If you are healthy, have no known fertility issues, and are in the early stages of trying to conceive, this method is a low-cost, low-risk option that is easy to try. It can provide a sense of empowerment in a process that often feels out of your hands. However, a menstrual cup is not a replacement for proper fertility care. It is crucial to remember that it cannot solve underlying medical problems. If you have been trying to conceive for over a year or over 6 months, if you are over 35, it is best to consult with a doctor or a fertility specialist. They can conduct tests to identify any issues and recommend evidence-based treatments that have been proven to work. Ultimately, if you are looking to add another tool to your fertility toolbox, the menstrual cup hack might be worth a try. Just go into it with realistic expectations, prioritize hygiene above all else, and view it as one small potential boost among the many factors that lead to a successful conception. Who knows? For a small investment and a little bit of effort, it might just be the quirky little trick that works for you. You never know.